Hello, everyone. Welcome to my poster presentation on digitizing dementia care during COVID-19. I'll be talking about lessons we learned scaling up partner imbalance during the pandemic. My name is Hannah Christie. I'm a postdoctoral researcher at the Alzheimer Center Limburg in Maastricht. And my research is on implementing evidence-based technological innovations for dementia into practice. So the COVID-19 pandemic has had serious consequences for the mental and physical health of people with dementia and their loved ones. A survey by Alzheimer Netherlands showed that 61% of carers feel that care is harder to provide since the start of the pandemic. The pandemic has also changed attitudes towards digital and online support in general and forced healthcare systems to reinvent themselves in new digital directions. Benefits of this include the ability to reach more remote populations, to scale up in a cost-efficient way, but also now to provide safer support alternatives to informal carers and to healthcare professionals and to vulnerable populations in general. And another recent survey by Alzheimer Netherlands showed that informal carers are increasingly comfortable with digital support solutions, and have been using platforms much more for messaging and video chatting, such as WhatsApp. In this context, partner imbalance is a relevant example. It's an online support intervention for informal carers of people with dementia. So in partner imbalance, it lasts 8 weeks, and the carers receive or complete a number of modules, 4 in total, where they receive tips from other carers through videos, they receive information, they complete assignments with feedback from a coach. And the central idea is really self-management and being able to find their own solutions to the challenges they experience in a stepwise approach, and also to really be able to apply that approach in the future, as dementia is a progressive disease that keeps changing, and to really give them the tools to be adaptive and solving their problems in that way. The partner imbalance coaches are care professionals who have experience with dementia, and they become partner imbalance coaches by doing an online training. So previous research has shown that partner imbalance is effective in improving quality of life, sense of competence, and self-efficacy in informal carers. And it was chosen as a project to scale up rapidly during the COVID-19 pandemic to provide more remote support options in a scaling up project funded by Zonnemuur in the Netherlands. So a first key lesson from this scaling up was that we really needed to increase the self-efficacy of healthcare professionals. So in the past, we'd always focused on the self-efficacy of the carers without thinking about the fact that we were asking something quite scary of the healthcare professionals in a lot of ways, to learn a new tool, to write all these things down in conversations with carers. So the scaling up experience really showed us that we really need to sufficiently prepare carers so they feel motivated and capable of using these digital solutions in daily practice. And this is a perspective that's often overlooked in implementation. Secondly, it was really important to make sure that the training spoke to all types of professional carers, so they could be these coaches that we trained could be case managers or nurses, and it was really important to tailor the training to them as well, and not just to the carers. So the training really spoke to their needs, and they felt motivated to continue and to really use it in practice. So to conclude, this accelerated implementation really illustrated the potential of the healthcare sector to increase its digitization, which has actually long lagged behind other sectors. And to avoid losing this momentum that the pandemic has given us, there's really a need for online trainings and interventions to focus on increasing self-efficacy in the healthcare professionals and in the people who are implementing it, and to really focus on tailoring it to the needs of those people as well. And this will be crucial for the adoption of evidence-based tools also after the current crisis. So yeah, that's the end of my presentation. Thank you very much for listening, and please enjoy the rest of the conference.